I want to learn a lot about the research and what's up to date.
Meet some people, do a bit of networking.
And compare what I do in my practice, what other people are doing in their practice, and then take it back and apply it back at home.
So we're at the Hilton Northampton, and this is the annual national conference for the Association of Chartered Physiotherapists in Neurology. And the title of the conference this year is Expanding Minds and Networks, and what we aim to do with the programme was to sort of challenge people who were coming to maybe perhaps think a little bit more broadly about their practice and how they apply their practice.
I'm going to kind of give a little bit of an overview today about some of our interventions and our approaches that we've kind of developed for people with Huntington's disease. We want to really start thinking about the underpinning theoretical frameworks and what it is that we as therapists need to be putting into these interventions to make them work.
I was just hoping to get a bit of a general idea of what's going on research-wise and how we're looking forward to the future and progressing the neurophysio in the future.
To update my knowledge on recent current neurological physiotherapy in the areas that we're discussing today.
Our team at King's had just completed a 3-year very detailed study into community rehabilitation service delivery in long-term neurological conditions in London. There's a lack of a clear pathway from hospital to community, which could compromise early supported discharge.
I've just really enjoyed looking at the interactions, looking at the listening to the speakers, and really that sort of sense of enthusiasm that starts to rise as we move through the conference.
Participation and vocation to an occupational therapist are all part and parcel of occupation in the way that we perhaps think about it.
So I think people are, it gives people a chance to actually stop, think, reflect about their practice, and it's the incidental conversations that you hear, it's all the people making connections with what they're doing in their workplace, but also what they're hearing through the speakers. And I think that it doesn't happen straight away, it happens almost as a continuum through the conference, and that's been really exciting.
That was really interesting. Didn't feel too big, so you felt like you were part of it, easy to ask questions. And some really good speakers, very relevant.
So my brief is to update you on so-called disease-modifying therapies for people with multiple sclerosis. And it is a very exciting time to consider this topic because we have a raft of new drugs coming through, and I'm going to share with you some data on their efficacy. We in neurology and you in physiotherapy are travelling along together to try and have better treatments available for people with MS.
So the breakout rooms, I think that's a really good idea of ACPINs. I think actually what people need is sometimes to break out of those sort of plenary type sessions and get into smaller groups and debate. I think physiotherapists are naturally really good chewing over problems, talking about their practice, sharing exemplars or strategies or challenges.
They said that they wanted like a mentoring in the community, so that buddying up of with other people having had strokes. They wanted more services that helped them get out the house. There's very much stories of isolation going on. They wanted help to access other services in Tower Hamlets. People didn't really know what else was out there.
So far we've heard some fascinating talks that have really put the patients and the service users at the centre of what they're actually doing, whether it's a physical activity programme, whether it's looking at problems such as falls, whether or not it's actually just hearing their voice, and that's something that seems to have been a resonant theme.
What I'm looking at in terms of my research is looking at falls in multiple sclerosis, and hopefully what I'm going to talk about today is some of the stuff that we've done so far to start the process in terms of looking at what the problems are and what sort of interventions we might be able to develop to help people with MS who fall.
That's what's really good about the conference. Now what we're starting to do is get a really good blend between research, policy, the sort of politics of what's going on in health and social care, as well as hearing examples from service users, from people with neurological conditions themselves.
This is quite scary, being in front of a load of physiotherapists. Am I sitting straight and level? And can I relax without anyone shouting posture at me? Good support network of other people with MS. It's very important, I think, to talk to other people. Share experiences. When all people with MS are different, their backgrounds, how the MS affects them, but there are certain things that we can share.
We like to invite exhibitors every year because technology moves on, particularly rehabilitation technologies, and there's some fantastic innovations out there. So we like to sort of make sure that members stay up to date and actually be able to interact, not just with the salespeople, but actually the products themselves, get to try them out, have a walk around, see what things feel like.
I've really enjoyed some of the debate this year and the application between different diagnostic groups.
It particularly made me think about sort of the delivery of the service, to talking to the people that are actually experiencing it more.
I think the theme that kept coming out is that as therapists we need to really challenge patients.
It gives people a chance to actually stop, think, reflect about their practice.